I haven't used my voice for a while. Hi, good afternoon everybody, and thank you for seeing it through to the end and staying for the talk. My name's Samantha Holloway. I'm a lecturer at Cardiff University, and I run the MSc in Wound Healing and Tissue Repair, so that's a little bit of a plug. Building on what Karen Uzi said, if anyone's interested in any postgraduate courses, please come and talk to me. But I'm here today really as chair of the European Wound Management Association Teacher Network, which I've chaired for the last 3 years. And so pretty much like this morning really, you're the first group to have access to the data and results from a survey that we've done. So I'll be interested to know your views and what you think about the results. When I took over the Teacher Network, we talked a lot about some of the work we could do. The work we do is not funded. It's very difficult to get educational funding grants. So we talked about some work we could do as a group across Europe around education. And one of the common themes that came up was that, what are student nurses taught in the curriculum? Across Europe, it was the same. It was, well, we don't think they're taught very much from what we see on the wards. So we talked about doing a piece of work around that to try and gather some data from across Europe of interested countries looking at what is currently taught. So that's what I'm going to present to you today. The other context of the project was that to give us some sort of theoretical background and framework to it, what we based the project on was the NMC standards for pre-registration nursing education. So we based them on the UK standards, albeit that across Europe there are different standards, but many countries follow the same sort of NMC guidance. And so these are the 2010 guidelines that we were working from. One of the initial problems we had was that we were aware there was going to be an NMC review of the curriculum, which was happening around about the same time we wanted to undertake the survey. But because that NMC review process probably took a little bit longer than expected, and it still is in development, that's why we're working towards the 2010 standards. So from my understanding of looking at the information before I came along to the conference, the NMC engagement process is still underway, and there's been a consultation process, and according to their website, there were going to be some new standards available as of now, but I haven't seen those yet. But it is expected the pre-reg standards would be adopted by HEIs in September 2019. But talking to colleagues here who work in higher education have already said that rather than have to wait any longer, they're actually looking at the pre-registration nursing curriculum now and kind of guessing what changes there might be and presuming perhaps there won't be too many, and working forwards with that. So if you look at the 2010 guidelines, within that, there is mention of skin health and wound management, so that the programme must provide content in that area. But it doesn't actually give you any more information than that. So you can imagine many different universities maybe have adopted different approach to that. But, what do we mean by skin health and wound management? And then the other guideline or standard was around asepsis, so making sure that newly registered graduate nurses are safe to apply the principles of asepsis. So those were the only two things we had as a basis for starting the survey. So one of the things we did was look at the literature about what's already been done in the area as well. And if we look to studies in the Estates by Elizabeth Aiello and others, they identified a gap excuse me, in the integration of best practice guidelines in pressure ulcers in particular. And then Zena Moore and others did some work around looking at how many hours are pre-registration nurses taught in the curriculum. But that was by asking people who teach. So how many hours do you teach? And then Spain also looking at nursing undergraduate curriculum and found that pain management was not addressed very well in the undergraduate curriculum. And when I looked more recently, there has been a semi-systematic review undertaken by Welsh for Scotland, I think it is. And one of the comments in that really was around programmes pre-reg and undergraduate and post-reg should be established in terms of structured wound care. So here we are in 2018, still in the same position as saying that maybe they're not getting enough in the undergraduate curriculum. So I'd say that was kind of the theoretical framework for that. So initially what I did in June 2016, Wales is that very small country on the edge of the UK. What we did there was just do a pilot study of the 4 Welsh universities and looked at any university that did teaching degree level nursing in Wales. And so those were the 4 universities that took part in that pilot. So for the pilot study, what we did is we developed a survey tool using Bristol Online Survey, and we came up with 12 questions we wanted the universities to answer. So those were around the numbers of pre-registration students enrolled, whether that be on any type of degree in nursing. And that was really to get a feel for the numbers of the universities and the numbers of students. Then at that point, we left this as an open question to say, what skin health and wound management topics do you teach on your programme? So that was an open question. We didn't provide any list of choices for that. We then looked at what years of study, so trying to get a feel for when our student nurses taught what. And then also looking at the number of classroom-based and skills laboratory teaching hours. So what's taught in a practical setting and what's taught in the classroom, and then also looking at learning outcomes to try and pull out what learning outcomes there are in the student nurse curriculum around skin health and wound management. Because we're being an academic, I'm also interested in how do they assess this. So are we assessing this through purely knowledge, multiple choice questionnaires, essays, or through direct observation and clinical practice? And another comment is, and this was a very general comment, which I'm not haven't got a view either way, but often the comment is that the people teaching these topics don't know anything about wound care. And I know from maybe my own experience of working in a school of medicine, sometimes you're asked to teach things you don't know a lot about. So you either say, look, I'm really not happy to teach this, or you read up about it and you have to teach it. But around that is that good practice. And then also trying to look at opportunities for clinical placements for student nurses too. So those were the main areas that we wanted to look at in terms of the pilot. If I just go back to the moment. So I haven't presented the pilot results here, but just what came out of that was, it was really disconcerting, really, was how difficult it was to fill the survey in. Having open questions made it much more difficult, and the response rate was, not very good. So from that, we had to then decide, well, we want to still move forward with this, but how do we make it a better survey to carry out? So at the UMA Teacher Network meeting in Amsterdam last year, we kind of really talked about, well, what do we want to ask and what will we change about the survey? So through an iterative process, we refined the survey tool, and what we did is came up with much more closed questions for the survey, which then hopefully people would be more willing to answer. So the questions covered, and there will be a little bit of repetition here, but there is some things that have been left out from the pilot study. We wanted to know about the professional qualifications still, so what, as a HEI, what do you teach in the adult nurse and education programme? Then the percentage of training provided across theoretical and clinical, and what wound-related topics were taught at the undergraduate level. And then of those, what are taught at laboratory or simulation-based methods. And again, we kept the years of study, so trying to get a feel for when of these topics being taught. And then also trying to get a feel for classroom-based teaching hours too. Assessment of clinical competence was added in, which wasn't previously, because the higher education institutions felt that should be in there. And of that, what's in hospital or community. And again, we kept the information in there about assessment methods as well. So how are we assessing knowledge and skills? So this was the main study, and it's not a repetitive slide. It is similar information to I've shown you before. But again, you'll see, if I just pick out there, some of the changes we made was that we gave people a defined list of 34 choices of different topics in wound management that possibly could be taught. And that was just through gathering information from everybody. and as well looking at the number of lecturing staff as well in the faculty. I think those are the main changes. So the main survey ran between April and October. It probably wasn't the best time. Leading up to when we had the survey tool ready in April, it was very much, oh, well, everybody or some people will be on a summer break now. So we kept it open till October to allow for those who wanted to run the survey when the new students started in the September of 2017. So across Europe, in the teacher network, we have a number of countries represented, and the majority, 21 of the countries, expressed an interest to take part in the survey, but 18 actually then did some work around that. And so those are listed there as to the countries that took part and the number of responses we've got from those, plus the survey lead. So for today, to try and make a little bit more context of the UK, I'm going to be presenting data for the UK rather than for the whole of Europe, but anybody coming to UMA will have a little bit more information about the results across Europe on the May the 9th at the Teacher Network session. So if anybody is here who teaches in a higher education institution and wants to be part of the Teacher Network, again, come and see me because we can maybe get you to come along to that meeting. So as we contacted 89 HEIs across the UK, very poor response rate of 21%, unfortunately, so 19 responded. And if you look at the degree courses that are run, you can see that England had the highest, well, England and Scotland had the highest response rate in terms of the degree. So it is the degree qualification we're concentrating on for this. When we look at the results for across Europe, we have to take into account countries that are still teaching certificate level. So places like Germany don't have degree level training. So it's been quite an interesting piece of work to look at that. So you can see the numbers of students enrolled across the bottom there, with some universities, particularly Wales surprised me, but I think there are a couple of intakes in Wales, so up to 1,200 students in 2016. In terms of the percentage of theoretical and clinical training, if you look at the NMC guidance, that 2010 document I mentioned, it says in there that theoretical training should account for 50% of the curriculum. So it was no surprise really that all the universities responded that they provided 50% of that. And in terms of how the hospital and community placements were split up, those are shown there. So you can see that in some areas, and in some areas of England in particular, we've got a 40% community placement, which is, I don't know if that's high or not high, but when you look at our results, it's one of the highest there. But probably no surprises in terms of how the training is split. And here we have a summary of the, remember I said there were 34 topics, areas. So they're in no particular order initially, but what I've done here is done a thematic analysis, a really sort of basic thematic analysis, and tried to present the data in a way that makes sense. So you've got the 19 responses here, so the 19 higher education institutions that responded. And so I've kind of divided that into numbers that say they teach that area in the curriculum. So you can see all but one, and I think one of the universities, rather than break it down, provided an overall response to the survey, hence why there's only 18 as the most you can see there. But you can see from skin anatomy and physiology through to things like factors affecting healing, pressure ulcers, as you might expect, principles of asepsis. You know, the majority of HEIs are teaching those. Not many less are teaching around wound physiology, debridement, dressings and surgical wounds. And similarly for the other things listed there, such as psychosocial factors, we move down to leg ulcers, IAD and so forth. Still fairly high numbers, 15 out of the 19 are teaching all those topics. And then if we move down to the bottom, I guess as you might expect maybe, unusual and atypical wound presentations, not so many are teaching. and management of fistulas and drains as well. So that was quite a positive thing, that the HEIs are actually saying they teach these areas. And then when we look at how many of the areas are taught as laboratory or simulation-based teaching, again, I guess it's no surprise, and we'll pick out principles of asepsis there, is taught in a lab or simulation environment, because that makes sense. It's a very practical skill that has to be assessed as part of the NMC standards. But wound assessment, wound dressings. So again, I'm not sure if anything, will surprise you from this data, but if we look maybe towards the bottom, some of the things that aren't taught in laboratory simulation-based kind of make sense as well, because unusual atypical wounds, lymphedema, legal and professional multidisciplinary teamwork, you might add, depending on how you want to teach a subject, can you teach those subjects in a practical or simulation-based way? So I'm not sure that we can really take much away from this, but again, if we look at the data, it's around what subjects, what topics would you expect practical skills to be practiced in a laboratory and simulation-based environment. I've kept the numbers in, so for this I ummed and ahed and tried to colour code it to make it a little bit easier to read. But it's quite interesting now to look at when. So when in the curriculum are topics taught? And so you've got year 1 is kind of in blue. I don't know how well that comes up, but you can see that in year 1, we're teaching students sort of around anatomy and physiology, skin assessment, skin care, normal physiology, principles of asepsis. And I kind of feel that's actually a fairly good basis for year 1 students. You might expect them to be able to do that. When we look at year 2, we can see that there's a lot more subjects taught. And in fact, that's where the bulk of the students' topics are taught, as you can see. So again, maybe that's no surprise because you're building on the year 1 knowledge. And then as we get to, there are 2 topics that are taught across years 2 and 3. That was management of fistulas and drains and wound documentation. And then in year 3, we have most of the universities are teaching about leg ulcers, lymphedema, and malignant wounds. So you might say perhaps leaving the more complicated things towards the end, or you could argue, well, they're not particularly complicated, but, in year 3. So, again, you're the practitioners out there. I wonder how you feel about the balance of when students are being taught. Are we teaching too much in year 2? And are we not teaching so much in year 3? And maybe year 3 should be where we're looking at teaching more of the subject area. In terms of classroom-based teaching hours, and this was more difficult. I thought it would be, I don't know why, I thought it would be easy for people to say to me, yes, we teach, 3 hours a week of this, 4 hours a week of whatever, but no, it didn't seem to be the case. But if you look at the timetabled sessions, this was the idea that people would answer this question, throughout the 3 years, what are the timetable sessions you have for these topics? And there was a big range, and I think the range of hours that are taught reflects maybe the particular interests of the HEIs. So I don't know which HEIs answered this survey, but I do know that places like where Karen works, maybe Ray answered the survey, I don't know. But there's a lot more focus on wound care, so perhaps where there is a focus on wound care, that's where you're going to get more hours taught. But we have a range of hours of principles of sepsis and wound pain range in hours from 1 hour being taught to 12. Again, I'm not saying that's right or wrong, but it might be quite surprising. And then other subject areas, as you can see, they're listed kind of in that yellow box, 1 to 8 hours. So the minimum we can see is at least an hour on a topic, but the maximum we're looking at is potentially 12 hours on a topic. And, for those of you, lymphedema keeps cropping up, so I wonder what Karen might think of this, actually, is that, 1 to 2 hours of teaching on lymphedema and malignant wounds and palliative care. is that because we're thinking maybe that that's something at a post-registration level people might specialise in more, and maybe when you're newly qualified, those are not the things you need to know about. But, skin tears, burns, trauma, fistula and drains again crop up as sort of 1 to 3 hours. Leg ulcers, anything from 1 to 5 hours. So at this point in the survey, one university mentioned, and this is why there was lacking information in earlier questions, is that they have 50 hours in total for wound management related topics in the 3 years. One reported 8 theoretical hours over 4 years, and one mentioned that the hours were distributed over 3 modules in year 1. So there's quite a difference in a way that it's being taught and how many hours are being taught. Clinical competence, in terms of the topics that came up highly, so principles of asepsis, wound documentation, skin assessment, wound assessment, and wound pain assessment and management. I kind of picked those out as the highlights from what is being assessed in clinical practice. So again, it's your thoughts as to whether that's particularly appropriate or not. And some of the subjects not assessed in clinical competence-wise, as you can see, we might argue that they should be. In terms of assessment methods, so the first yellow box that's highlighted up there with a couple of arrows is showing that the main ways we assess student nurses' knowledge is through short answer questions and direct observation in clinical practice. So I think it's nice to know that we're not relying on MCQs and those sorts of things in the main, because we might argue that can just test factual knowledge, but if you're having to write short answers and being observed, then perhaps that's more a robust way of assessing clinical competence. Number of lecturers ranged, again, that would be on the size of the higher education institution. And then when we look at other healthcare profession involved as teachers, because we're interested to know, wound care is a multidisciplinary specialist subject. We'd like to think that there are other people teaching other than the lecturers. So what you can see here, what initially looks like, not many other professionals teaching across any of the courses or across the HEIs. But I think what's pleasing to know from this, that many of the universities reported that they have placement opportunities for students. So students are getting opportunities to be placed with the TVN, clinical nurse specialists, particularly specialist wound clinics and leg ulcer services. So I'm not sure that we should look on this too negatively, that it's not being taught in a multi-professional way in the classroom. The students are then going out and having placement opportunities with experts in the field. So just a summary of the key findings. Unsurprisingly, the percentage of reported theoretical and clinical training follows the recommendations of the NMC. All HEI's questions reported that all of the wound management topics are taught as part of the curriculum, but I've just picked out a few there that are taught less frequently. In terms of the topics taught using laboratory and simulation methods, wound assessment, wound dressings and bandages, and principles of asepsis were the main ones that have been taught in a sort of a simulation environment. And with regards to the year topics are taught, the majority are covered in year 2. So 19 topics of the total of 34 are covered in that year 2 period. But the number of hours varied widely, but I'm not sure how much importance we can place on saying what's the minimum, but depending on what university you go to, you're going to get a lot more teaching in some than others about wound care. And in relation to clinical competence, principles of asepsis was obviously something that was assessed, but strangely enough, only 16 of the 19 HEIs reported they were assessing that, yet that is an NMC standard. And as already said, short answer questions and direct observation in clinical practice were the most commonly used methods. And there was a bit of a little bit of a mismatch. So whilst the participation of the wider multidisciplinary team in teaching on the curriculum appears low, I think I've already sort of said to you that the positive is that students are getting out there on clinical placements. So the limitations are that the response rate was low, and like any survey, I think people who had a more positive attitude towards the topic are likely to have responded. So it would have been good to know some of the other non-responders, but that was difficult to follow up on that. It was an anonymous survey, and we couldn't follow up on the non-responders, despite sending out lots of reminders about the survey. And there may be a risk of response bias, as I've mentioned. And there's a little bit of an inaccuracy. Some HEIs reported topics are taught as part of other modules, and so they can't actually provide accurate information and pick out the number of hours. But I was hoping that the question on how many hours in classroom are taught would pick that out, but it seems it didn't. So I think overall, the results indicate a positive level of teaching in skin health and wound management. Whilst the reported level of theoretical teaching for topics such as leg ulcers is high, there's actually a mismatch between that and the year in which the actual topic was taught. The number of classroom-based hours was difficult for the HEIs to quantify, so I'm wondering if we probably should have tried to gather that in a different way. And the assessment of clinical competence of principals of asepsis was unsurprisingly high, because they have to be able to do that to be able to register as a nurse. So the next steps of the project were thinking about, well, one of the intentions was that we will come up with this wonderful curriculum that we can suggest to all HEIs that student nurses should be taught. But I know there's work going on in NHS England around that, with Jackie Fletcher developing some work, and other work streams I've heard about this week is about education for different types of etiologies. But very much this is pending the outcome of the NMC review of the curriculum, because we don't know what the new curriculum will say in terms of skin health and wound management. But one way forward, and the publication that's already out there came out in December, was the wound curriculum for nurses. Now, whilst this is post-registration, it's level 5, and level 5 is really year 1 and year 2 of an undergraduate curriculum. So the level 5 curriculum may be a starting point for people to look at and pick and choose from that curriculum for teaching, if you have a role in teaching student nurses. And then also one of the things we wanted to do was look at doing a qualitative study of nurses within the first 6 months of qualifying to see what they think they should have been taught. So within that first 6 months, now you're working on a ward, what do you wish you had have been taught as a student nurse so that you could function as a newly qualified nurse? So that's something I'd still like to try and do, but I'm not sure how forward, whether we'll get much forward with that, but we'll see. And I've put something else there because that was where, being able to present the results to you today, there may be ideas you have about something else we could do around pre-registration student nurses and education as well. So I'm open for comments and suggestions. And just to let you know that there is the level 6 post-registration wound curriculum for nurses in development. So if you go onto the UMA site and look at the teacher network, as myself, Sebastian Probst, Andrea Picorno and Sarah Rowan from Italy, we're working on the level 6 curriculum. Now level 6 would be the third, so year 3 of the undergraduate curriculum is where you're looking at those level 6 outcomes. So again, there may be a document that's already out there soon for you to use if you wanted to look at using that as well. So with that, thank you for your attention. The amber light just flashed, which meant there was about 5 minutes left. So I guess it's time for questions if there are any. Thank you.
Yep, so we've got time for questions and comments.
There's one.
Hello, Tim Gooding. I think you'll find it really interesting if you asked newly qualified students what they were taught in the previous 3 years, because I think it would be remarkably different to what the universities are saying they are teaching the students.
Yes. That was one idea we had. It's just, being able to capture some student nurse populations, but that's certainly one area we thought about doing, was looking at that, what were you taught? Yeah,
because I can recall 5 years ago I qualified and I wasn't taught anything really about nursing in 3 years.
Okay.
So it'd be interesting to know now if that's changed.
Yeah, well, that's something we can certainly look at. Yeah, thank you.
Hi, sorry, I'm behind the screen, so you can't really see me. Thank you very much for your presentation. Just one of the a comment or a query really is, in terms of the teaching, was there any evidence around a gap between when they got the information to when they were assessed practically, and information about if there was any continual assessment of practice afterwards?
That wasn't something we've captured in this survey, but yeah, I take your point. It would be interesting to look at that. This was really the first stage of looking at, what is taught. So we have got a feel for what is taught, but yeah, that might be something else that we can do. And building on what you've just said is, asking the student nurses how long was it between being taught and being assessed. So that could be built into something as a qualitative piece of work, I think.
Any more questions or comments? Okay, thank you very much, Sam.
Okay.